Yo, what's up everybody? I'm your boy Numbskull and welcome back to the party. This video is the next entry in my harm reduction series where I talk directly to people who choose to use drugs and give them the information they need to do so as safely as realistically possible. This series is not here to encourage or discourage use. It exists because people are going to make their own choices and accurate information is what actually prevents harm. Today, we're fulfilling this baller's request for an LSD video, also known as acid, and this is one of those substances where misinformation and bad advice have caused a lot of unnecessary trauma over the years. LSD, or lysergic acid diethylamide, is a classic psychedelic. Pharmacologically, it works primarily by acting as a partial agonist at serotonin 5-HT2A receptors, along with activity at several other serotonin and dopamine receptors. This is what causes the profound changes in perception, thought patterns, emotions, and sense of self. LSD does not cause direct neurotoxicity, it is not physically addictive, and it does not damage the brain in the way that many myths claim. But that does not mean that it's totally risk-free. One of the most important things to understand about LSD is, of course, potency. LSD is active in micrograms, not milligrams. A difference of 20 or 30 micrograms can significantly change the intensity of the experience. Because of this, guessing dose is one of the biggest risk factors. Blotter paper, gel tabs, and liquid LSD can vary wildly in strength. You cannot reliably tell how strong a tab is by appearance, taste, or size. Starting low and not redosing is one of the most important harm reduction principles with LSD. Another critical safety point is testing. LSD is commonly confused with or replaced by other substances, especially, although a little less in recent years, N-bomb and NBOH compounds. These substances can be far more dangerous and have caused deaths at doses people assumed were LSD. LSD is active orally and works when swallowed, while many N-bomb compounds require absorption through the mouth and often have a bitter or numbing taste. Using reagent tests and, ideally, Ehrlich-Hoffman testing specifically is a major safety step. If it's not confirmed LSD, it should not be treated as LSD. Set and setting matter more with LSD than with almost any other drug. LSD strongly amplifies your mental state and your environment. Anxiety, stress, unresolved emotional issues, or chaotic surroundings can easily spiral into overwhelming or even traumatic experiences. A calm, familiar setting, a stable mindset, and people you trust dramatically reduce risk. LSD is not something to take casually when you're already in a bad headspace or in an unpredictable environment, and is not something to be used for escape. Dose timing and duration are another key factor. LSD is long-lasting. Effects can last anywhere from 8 to 12 hours, with after effects sometimes continuing even longer. This means you need to plan your entire day and night around the experience. Taking LSD at night can result in being unable to sleep until the following day, which increases mental strain and anxiety. Redosing LSD rarely makes the experience better, and often just prolongs stimulation and increases exhaustion. LSD should not be mixed with certain substances. Combining LSD with other serotonergic drugs, including MAOIs, some antidepressants, tramadol, DXM in some scenarios, or MDMA in some scenarios, can increase the risk of serotonin syndrome. While LSD alone rarely causes serotonin syndrome, stacking a bunch of serotonergic substances significantly increases the risk. Mixing LSD with stimulants increases anxiety, cardiovascular strain, and the likelihood of panic. Combining LSD with alcohol can dull awareness while increasing impulsive behavior and accidents. People with certain mental health conditions should of course be especially cautious. LSD can worsen anxiety disorders, panic disorder, bipolar disorder, and psychotic conditions such as schizophrenia. Even in people without a diagnosed condition, LSD can bring latent issues to the surface. A family history of psychosis is an important risk factor. LSD does not cause schizophrenia, but it can trigger the onset of symptoms in vulnerable individuals. Another often overlooked risk is dissociation from reality and impaired judgment. LSD can significantly alter perception of danger, time, and consequences. This is where most physical harm occurs, not from toxicity, but from unsafe behavior. Avoid heights, bodies of water, driving, or interacting with dangerous objects. Having a sober and trusted trip sitter, especially for first-time or higher-dose experiences, is one of the best harm reduction tools available. Hydration and body awareness still matter. LSD is not dehydrating on its own, but it can suppress thirst cues and increase physical activity. Sip water regularly, eat light foods if possible, and listen to your body. Muscle tension, jaw clenching, and restlessness are common and not dangerous on their own, but severe confusion, chest pain, or extreme agitation are not normal and should never be ignored. It's also important to talk about tolerance and frequency. LSD produces rapid tolerance. Taking it multiple days in a row dramatically reduces effects while increasing mental strain tenfold. Frequent use increases the risk of anxiety, derealization, and persistent perceptual changes. Spacing out experiences by weeks or months is significantly safer than repeated use in short time frames. Now, another rare but real risk is HPPD, or hallucinogen persisting perception disorder. This involves ongoing visual disturbances after use. While uncommon, risk increases with high doses, frequent use, and pre-existing anxiety and other conditions. Avoiding excessive dosing and allowing long recovery periods greatly reduces this risk. And finally, know when to get help. Extreme confusion, panic that cannot be calmed, dangerous behavior, or a complete loss of contact with reality in a dangerous manner are situations where outside help may be necessary. If medical help is needed, honesty saves time and lives. Medical professionals are there to stabilize and protect, not to punish you, not to judge you. So don't lie. To wrap this up, LSD is a powerful tool that demands respect. It can be meaningful, insightful, and beautiful, but it can also be overwhelming if you treat it casually or like some other party drug. Most LSD-related harm comes from unknown doses, misidentified substances or misrepresented substances, poor set and setting, dangerous combinations, and a lack of preparation. Testing your substance, starting low, planning your environment, avoiding risky mixes, and giving yourself adequate recovery time are what separates safer use from unnecessary harm. If you found this video helpful, a like and a subscribe or follow would mean a lot and genuinely help this channel grow. Turn on post notifications so you don't miss future entries in the series, and consider sharing this with someone who could actually use the information. Harm reduction saves lives when it spreads, but it can only save lives if it spreads. Stay frosty, stay curious, and of course, stay safe out there. And with that, I'll see all of you homies in the next one. Peace!